Welcome to the So You Want to Work in Healthcare podcast. Today I have the pleasure of welcoming Dr. Cory Calendine from Tennessee. He is a hip and knee surgeon and also quite the influencer with over 600,000 followers across his platform. So welcome, Cory.
Oh no, influencer. I don't know that I can claim that, but I've certainly enjoyed connecting to a lot of different people. So thank you for having me. I think this is super cool.
Awesome. Thank you for taking time out of your busy schedule.
Yeah, it's been great. We're together at a meeting, obviously at AUKUS. And so we're here with 4,800 other people.
Is that the number?
Great opportunity to sit down together.
Yeah, great. Thank you so much. This is awesome. I come to this meeting every year. I love this meeting.
It is good. It is good. I have to say that because I work on a committee that kind of takes care of the industry dollars that help pay for the meeting.
Oh,
so
okay.
obviously I have to say, hey, this is a really good meeting.
It's a really good meeting.
Everybody should come.
Everyone
please.
in ortho should come.
Yeah.
All right. So let's get right into it. I want to know why you went into healthcare. Why did you become a doctor? When was it your first thought about it?
Yeah, that's a great question. I'm still contemplating whether or not to work in healthcare. No. It's been a long passion for me. When I was very young, I wanted to be Stanley Steamer, the carpet cleaner, because there was a really cool commercial on TV. But at a very young age, I thought I wanted to do medicine. Now, I was influenced. I had an aunt that was a GI doc. Obviously, that's impactful. And I have two older brothers, both of whom went into medicine. My oldest brother's a pediatrician, my middle brother's a radiologist. So all through my childhood, I had this draw to medicine and to be a physician. Now, in fairness, my dad was a cop and then a preacher, so that was kind of weird. And then my mom worked at Winn-Dixie for years and years. So there wasn't really medicine in my family, but there probably is something about my dad being a preacher that drew me to want to help people, as cheesy as that sounds. And it turns out that this is a field that you can do that it's kind of like, that's our job, to help people. So that's kind of cool.
Cool. I love that. Yeah. The fact that your dad, he was a cop and then a preacher.
Yeah. Talk about an odd mix. We lived in Naples, Florida. So everybody knows Naples, right? Big city now. But when I was a child, it was a small city. And he was a vice cop. Now, this is before Miami Vice. Are you too young?
No, I know Miami Vice.
You've heard it on reruns
I've heard
or Nick
about
at Night.
It.
Yeah. So this was before that. And he was an undercover vice cop.
Okay.
And what happened was his partner's identity became discovered. And one of the drug lords showed up to my dad's partner's house and roughed up his wife and kids. So the story goes.
Okay.
And so my dad found Jesus. And we moved to Tennessee, became a preacher. So fairly unusual career path, as you've mentioned properly.
Yeah.
Yeah. But yeah, that's how I got here.
But very interesting. Where did you go to med school?
I went to med school at University of Tennessee in Memphis. So when my dad had this transition, cop to preacher, we moved to Knoxville, Tennessee. So I really grew up in Knoxville, Tennessee, and then med school was Memphis, where the medical school is. It's the University of Tennessee, but it's in Memphis, not Knoxville. That's where all the college football is played, by the way. And then for orthopedic residency, I went to Vandy. So that's obviously in Nashville, Tennessee. So I've been in Tennessee for a really long time.
Yeah, Tennessee through and through. Was there anything you remember doing specifically to get into med school at that time? When did you go to med school?
Oh man, like in the 40s, I think, or something. No, so I my undergrad was at Freed-Hardeman University, a little private Christian college, and so I completed college in 3 years. And I would like you to delete that from the podcast because that sounds really geeky. But I guess I didn't have a lot of friends, so I had time. So college in 3 years, and then I spent a year in research at the Cleveland Clinic in Ohio, of all places, and then I came back and went to med school. I actually finished college in 3 years and they said, hey, we think you're too young. And I said, yeah, but aren't my scores good?
Yeah.
And yada, yada, whatever my defense was at the time. They said, well, we really want you to mature. And so I did college in 3 years and then took a year in between to do this research. Nowadays that's so common in healthcare. I don't remember your story, but it's so common that people will kind of get through their undergraduate degree, do something else first. I was kind of forced to do that, but it turns out that was a pretty cool year for me.
I'm sure the research helped with your applications too.
It probably did.
Not that you needed it, it sounds like.
Well, listen, I certainly was thinking that way. Like, what can I do to make sure I look more appealing the next round around, I guess is how you'd say that. But yeah, so I wanted to stay in medicine, but really that was my interest at that point. So it was natural. I did some research on the pediatric treatment of the common cold. You know those little zinc lozenges
Yeah.
called coldies?
Yeah.
So there's a paper in JAMA, the Journal of the American Medical Association, that has my name on it. I know. Zinc treatment for the
Wow.
common cold. Despite the fact I'm an
Oh,
orthopedic surgeon,
okay.
that doesn't have anything to do with it. There you go.
I mean, people swear by zinc.
Yeah. Yeah. It helps a lot of people. What the pediatric study showed, and this is public knowledge, of course, is it doesn't work in kids.
Oh, okay.
Yeah. Sorry.
Sorry.
You can
No
still
zinc
use
for
it.
the kids, I
You can
guess.
still use it. It's fine.
I did research undergrad. I didn't take a year off. That's actually like my one, I wouldn't say regret, but something I wish I did was take a gap year between undergrad and PA school. But I got to do research with this awesome PhD named Sylvia Finneman, she's like a leader in macular degeneration
Incredible.
at Fordham University in the Bronx. So I got to work with her, which was very cool. But I think that it definitely it helped separate my application from the rest for sure.
Well, and that's absolutely right. And I was thinking about that in between my freshman and sophomore year of college. Now rewinding a bit, I actually worked in a lab at the NIH, the National Institutes of Allergy and Infectious Disease, under a guy named, I don't know if you've heard of this guy, but under a guy named Fauci. Yeah. So Fauci's been there for like 100
Never heard
years.
of him.
Yeah. So Fauci and I were like, tight, and this is like 91, and he did okay for himself. I mean, he's made a name over time.
Okay. Yeah.
Yeah.
So med school was a full 4 years for you, or did you complete that in 3 years too?
Wouldn't that be something? I would have wanted to, I'm sure. Like, what is up with that? We're all rushing through, but no, obviously med school for me was 4 years, and then I went into orthopedics. And the reality is, and you probably know this, but maybe some of your listeners would be interested. You have to decide, like at some point, like what you're going to do when you grow up, right? Not being a doctor is not enough, right? In fact, I went into medical school and I thought I was going to be a cardiologist. I had a mentor in high school, and I actually received the Martin Luther King Jr. Community of Man and God Scholarship.
Oh.
So you can see I'm kind of like, you can see why I got that. No, it was a gift all about altruism, right? The guy sponsoring it was a cardiologist. He wanted to make sure that people were focused on that, and it was need based. So my dad was a preacher, so we were poor, and so it's a need based scholarship. So I was so impacted by him. But then when I got into medical school, I realized if you want to be a cardiologist, you have to go through internal medicine. And that really wasn't my jam.
Yeah.
Not that it's not critically important to the health of so many, but because I'm impatient and I have a little ADHD. So early on in med school, I realized I want to be a cutter. But meaning, someone who operates, it's such a crude term. Like
a cutter.
Yeah, cutter. Like you have to decide if you're going to be a cutter or not. So I wanted to be a cutter. And then I had to decide, well, what does that mean? General surgery, right? Orthopedics, they're surgeons, so many other types of surgery. I actually had only had 1 week of orthopedic surgery before I applied to orthopedic surgery residency.
Really?
So thankfully it all worked out. I really love it.
What did you see in that week?
Yeah, I mean, the guys were cool. And, there was good people to hang around. There is I don't know how honest we want to be, but there is a personality that aligns with certain disciplines in medicine. And listen, this is probably true in everything in life, but for example, orthopedic surgeons have, their own feel, maybe.
For sure.
Who is it? Glockenflecken?
Oh, yeah.
Did I say that
yeah,
right? This
yeah,
guy's
something like that.
absolutely
He's
amazing.
hilarious.
So, but he plays on these stereotypes,
Yes.
and everybody's like, "Oh, that's so funny." Yeah, most of them are true,
Right.
and so you're drawn to a certain group of people for whatever characteristics. So the guys were cool, and you get to use power tools, which is awesome, and you can change people's lives is the truth of it. All I do now is really hip and knee replacement. I know you do a lot of that. I mean, you have the ability to take someone who's truly disabled from arthritis, and they think that this is this is kind of it for them. And you can show them, hey, there's an answer. There's a cure for this
Yes.
problem. It's kind of a cool thing to do
It's very rewarding.
as a job.
Yeah.
Yeah.
I mean, and orthopedic surgery now is one of the hardest, if not the hardest residency to get into. Was it that way back then?
That's what I tell everybody, that it's really hard. You have to be really smart. And, it was very competitive when I came through. The year that I matched, I think was the first year that we beat out dermatology for the most competitive. I guess they look at like how many slots there are, how many people apply, this kind of thing. But it was very competitive. But interestingly, orthopedic guys, we talked about those groupings, we're kind of known to be the dumb guys in surgery a little bit. And I'm okay with that.
Yeah,
I mean, it's okay. What do they say? Orthopedic surgeons, twice as strong as an ox and half as smart, or something like that.
I don't know. I haven't heard that.
Oh, come on. Oh, yeah. I haven't heard. Yeah. Thank you for your professionalism. No, or like two orthopedic surgeons looking at an EKG.
Yes, definitely heard
A
that
double-blind study.
Exactly.
So there are thousands of them, but we get so narrowed in medicine, and I kind of know hip and knee replacement reasonably well. I want to serve my patients, and there's this anxiety that, man, I better stay up to date and do the right thing, because every patient, it's not on a scale. It's down to each and every patient needs the perfect outcome for their life, and so there's all this pressure to get your part of that healthcare window right. And that's what I think is so cool about this podcast is I know you're going to have me, knuckle dragger, kind of a dumb guy on here, but then you're going to look at all other fields of medicine. And even as an orthopedic surgeon, I mean, there's so many other people that serve my patients for the same goal. It's cool to be a part of in healthcare.
It really is. I mean, I love ortho, and it's a vibe,
It's a vibe.
It's a vibe. And I think we all feel it when we go into it. And I don't know if it's because most of the surgeries are elective and it's very hands-on, and like you said, you get to use power tools, which I love. But yeah, it's just a kind of a fun vibe.
Yeah, I think that's totally true. And obviously this could be regional. I mean, we had some general surgery guys when I was in training, and they were kind of angry, and tired guys. And I don't know that that's universal, but those guys, listen, general surgeons work so hard. But, I was trained in a time, like we said, back in the 40s, a long time ago. And surgeon behavior was also tolerated a little bit more than it is now. So, I was exposed to some surgeons that, due to the stress of their job, they would occasionally throw sharp things at people or in their direction. I don't encourage that. And and thankfully,
we don't encourage that.
Thankfully, we've evolved where this really is not and should not be happening in healthcare. But it is about where you are and what you've been exposed to, for sure.
Yeah, for sure. So what made you want to go into arthroplasty or hip and knee replacements?
Yeah, so I like the elective nature of it. So yeah, hip and knee replacement for me, you schedule it kind of thing. There's not a lot of emergencies. I actually really like orthopedic trauma, but the problem is, and I don't know if you've noticed this, but people get hurt at like any time of the day. In fact,
It's
often
true.
at night.
Often in the middle of the night.
Yes, and so that's such a calling that you can be available around the clock. So the quality of life, or the ability to build your life around orthopedic trauma, for example, is a little bit more challenging. So hip and knee replacement is a more elective posture for sure. They looked at surgical procedures, and of all the surgical procedures, I'm not talking about orthopedics. I mean, in all of medicine, all the surgical procedures that are able to return the quality of life years back to the patient. Number one is actually cataracts.
Oh, okay.
I know. I don't like to be not number one, but that's the truth.
Well,
The most valuable surgery to return quality life years back to the patient is cataract surgery. You literally take somebody that's nearly blind and they can see.
That's
You can
pretty
see why that
amazing.
would be incredibly powerful.
right.
Total hip is number two.
Oh,
So hip
okay.
replacement
I
works and
believe it.
works well. And I want to say total knee was like 3 or 4. Let's call it 3. But hip and knee replacement works. It cures the underlying problem. People do really, really well. And that's something just amazing to like show up every day. Unfortunately, as you talk about on your podcast, there's so many different roles. The doctors get the surgeons, the orthopedic surgeons, is what we're talking about, get so much credit for hip and knee replacement and the success of it. But listen, we are one piece in a much larger puzzle. I mean, I have a wonderful PA like you. It's such a valuable thing to educate and counsel patients through the process, the nurses, the therapy. I always tell people, look, you could have perfect surgery, whatever it is, hip and knee replacement or something else. If you don't have perfect therapy for some of these orthopedic surgeries,
Right.
you're in trouble.
Yeah,
And
for
so
sure.
physical therapy is so important. There's
Mhm.
just so many things that go into patient success that's not the surgeon. And unfortunately, I think we get too much credit.
The medical clearing doctors too.
Yeah, that's
They're a
right.
bit big.
It's exactly
big.
right. Keep the patient safe. First, do no harm, right? These guys we hadn't even talked about yet. What in the world?
But I would probably give the surgeon still a lot of credit.
Yeah, I mean, listen, I hope so. Like I try really hard. My mom's really proud. But really without the other critical elements, like that we just wouldn't see the successes that we do.
Right. And you specialize in anterior hip replacements, right?
Yeah.
I'm familiar with that because that's what my boss specializes in as well.
Yeah. So I mean, there's a lot of different ways. Some people are like, I don't want a total hip replacement. I want that anterior hip replacement. As you know, anterior hip replacement is just another way to get there. The parts are largely the same, but it's back to what we were talking about earlier. There's this healthy weight, this healthy burden that you want to do the best you can for the next patient, right? So there are techniques like posterior approach, which is a very great way to do a hip replacement. Again, the parts that we have can be trusted and relied upon. But with an anterior approach, there's less restrictions. I don't know what you guys do, but we tell them to avoid the extremes of motion. So there's not those limitations in motion early on. We found that if you go between two muscles instead of releasing some of the muscles in the back, they have less pain, a little faster recovery. So it's that constant pursuit to getting better and better. So anterior hip has been great for my patients.
Yeah, our patients love it. And, I mean, the precaution thing, I think, is the biggest perk.
Yeah.
The lack of precautions or not needing precautions, really. We don't give our patients any real precautions, like positional at least. But now there's also like the STAR approach posterior, right?
Yeah.
Where they're not, at least the surgeons at my hospital aren't giving precautions anymore. So
Right.
it'll be interesting to see the data that comes out. I think it's still within the first 6 weeks, there's a quicker recovery for the anterior approach. And then at 6 weeks, it's about the same. Is that right? Or has that changed?
No, I think that's right. There are champions for the anterior approach, and there's a lot of marketing. You guys who are just absorbed, being exposed to all the consumer marketing. There's a lot of marketing around it. So some things get said that are
Totally.
simply, an exaggeration of the truth, maybe, or just a good faith statement that doesn't have full evidence, right? So
Right.
there are things out there, guys, be careful for sure. But what I've found in my practice, like I know how I do a posterior approach, I know how I do an anterior approach, and when I compare my individual patients, they just have less pain and faster recovery.
Yeah.
But ultimately, when they're recovered, I think you should expect no difference.
Right.
Yeah.
Well, either way, it's a cool surgery. I love doing
Super
hips.
cool.
Yeah.
Do y'all do it on a table? Like
We do. I was just going to ask you this. I know this is getting a little specific, but no, we don't. We don't use the Hannah table.
Yeah. So the Hannah table is the one that I use, and the reason why I mention it is because it looks like you're putting a patient up on like a spit. What are those things over the fire or something?
Yeah.
We're really careful though. Just curious. Sorry.
No, I had to set a case up for another surgeon the other day with the Hannah table. It's cool.
Yeah. Are you nervous?
It's more work.
Yes.
It's a lot more work.
Yeah.
I guess I'm just, we've been doing it off table forever. So
Right.
I am partial to not using the Hannah
Of course.
table.
I think the biggest issue is you kind of do it the way you were trained, right? So
Right.
you're used to doing it without a specialty table. So why would you change? I trained with the Hannah table and have just never left.
Yeah, you're comfortable with it.
It probably doesn't matter, but I don't want you to take my table. But Steve Carell actually has a great comedy skit. Y'all should look it up. He apparently had a total hip. I did not do it. This is public knowledge. I've never met the guy. I did not operate on him. Full disclosure. But he talks about being wheeled into the operating room and seeing this table. I think he claims it was a torture device. That's not true. And so
It looks a little like
it does a little bit. It can be overwhelming. But these are tools that we use in order to execute the surgery.
And I think I would say the majority of anterior hip surgeons probably use it.
I think that's right. The ones that I've talked to and asked that specific question, it's the same surgery, but I think most are using it. Yeah.
And so would total hip be your favorite surgery to perform, or do you have another favorite?
Oh, that's a good question. Probably in life, my favorite procedure of all time is distal radius volar plating.
Oh,
Yeah, the
okay.
FCR approach. I haven't done that in 10 years. Like, keep that in mind.
Yeah.
But the anatomy is just so amazing. And maybe absence makes the heart grow fonder. I don't really do trauma anymore. But, and that's kind of why I like trauma. You could operate all over the body. But yeah, of the things that I do now, yeah, I think that's right. Anterior hip would be my favorite procedure.
Yeah, and the outcome is so great. I mean,
So
for
good.
most people, it's life-changing, and
Yeah.
they're happy so fast.
Yeah. It is so cool. And the hip joint is truly a ball and socket. The knee's a little bit more complicated. So I think you do a lot of knees too. That's a little bit of a longer recovery and a little bit of a harder, forget that you had a surgery kind of thing. But yeah,
And you were saying before, physical therapy is super important
so
after
key.
a knee.
Yeah, so key. Do you send your hips to formal therapy, or what do you
We
guys do?
we give them the prescription to go
Yeah.
outpatient. Most people go.
Yeah.
Some people don't.
Yeah, I mean, I think it's fine. Like, I mean, I did that for years, but now I've kind of flipped and I say, hey, these are some exercises, go home and walk. And
Yeah.
most end up not going to therapy now. It's just interesting.
Yeah, it is interesting. What do you love about being an orthopedic surgeon?
Oh man, like there's a lot. Like I really don't have trouble getting up in the morning. Like this job is pretty cool. Like for a lot of different reasons. I'm so thankful and appreciative of the respect that the field gets. It kind of gives you that confidence that you're contributing. But for me, it's all about that one patient. Like, listen, this is a hard business that we're in, and complications exist, and sometimes you can prevent them and you can learn from them. That's just the truth of it. But sometimes complications exist and we don't know why. And that's a really, man, for me, I take that stuff home with me. And I think I should. I think if there comes a point where, a patient doesn't have the perfect outcome and I don't think about it, I think I just quit. But the flip side of that, and what I love the most about orthopedics, is the ability to help that one person. Like I hear about it all the time. Oh, I could hang out with my grandchild, or I went on this Disney trip. Now, why would you ever want to go to Disney? I'm not sure. We love Disney. It's just very challenging, but you can get them back to the life that they want, right? It's not about, like, I don't know. I don't want to go to Disney, but for that grandma or that mom, people are so younger now, so much younger now for hip and knee replacement, but they're trying to get them back to their life. So that's what I love the most. No question, is getting people back to the life that they want, which is so cool. And they're so generous to share that story. Maybe that's one of the cool things about social media, is they just share it and you're like, golly, that makes it easy to get up. But listen, what I don't like about it is the documentation, like the EMR, right? Isn't that what I'm supposed to say?
Yeah,
Like,
I mean, yeah,
it's true.
It's a lot.
Yeah, it's
and
a lot.
It gets more and more and more every year. I feel like there's something new we have to do in addition to everything else. So yeah.
And look, there's a lot of good in trying to standardize care, and obviously we need to document what we do. And unfortunately, there are people in medicine, we all know these stories, that have not documented and done care that wasn't needed. And there are very few bad actors, but there are regulations in place that get applied across the board, and people in good faith trying to do the right thing get burdened with the paperwork. I think if we're not careful, that level of paperwork is going to, limit access to care. And in fact, many studies that show that it already has. I mean, because the work has to get done. And, most of us are, we want to do what's right. And so you want to do that. But there's some cool advances, like now I have a scribe. Do y'all use scribes?
Oh, no, but I wish.
Oh, this is,
that's great.
It's changed my life. I mean, maybe my soul. Like, and so essentially when I'm in clinic, I just walk around and talk, kind of like this.
Yeah.
And then somebody writes it down.
Yeah.
And, I go back and review it, of course, but that's really changed my life. So I think there are ways that we can make that burden a little easier. There are some cool platforms now. Are you doing like dictation, like with AI or something?
We used to do dictations, but I prefer just templates on the computer, and then I add in my own little things there, here and there, but no AI yet.
There are a lot of
AI
ways to
scares me a little.
Yeah, I get that. But there are many systems now that like listen into your clinic visit, like just like you and I are talking, and then it creates a note.
Wow.
Which is I'm with you. Like, that sounds really
That's
cool.
cool,
Wow.
but crazy.
And crazy.
Yeah.
So I'm not totally sure how I feel about that, but for now, the
know.
scribe, the person with me in the room, is super helpful.
Yeah, scribes are great. I should probably interview one. I'm going to put that on my list.
Oh, listen, they're an important role. You know, the challenge with them is they're all going to something else. They're all going to be
Yeah,
you
they're
one
all-
day, or
yep.
me, or something.
Yep.
You know, they're going into another field. They use it as a stepstone. We were talking about the research. They're getting exposure in healthcare, which is another great way to bulk up your application, of course. And so they're being ascribed to do that.
We don't love the paperwork, but other than that, it seems like a pretty great gig.
It's pretty amazing. I'm so thankful. You know, for as much as I'm out there on social, I don't want you to know how sensitive I am, but kind of a sensitive guy. Like, it really is one of those things that if I think about, how I get to do this every day, like this is the job. Like, you got to get up and you got to go help somebody. Like, that's the job. And like, oof,
Do you ever get tired? I mean, I feel like
tired.
For us, it's, I'm at a hospital where it's very, very busy.
Yes.
So we're always going. And sometimes I don't know how these surgeons do it with the hours they're putting in, and with families, and how do you deal with your work-life balance being a surgeon?
Yeah, it's tough, obviously. And listen, not just as a surgeon, right? For any of us in professional life, we're trying to figure out. For me, the balance word is always a little tricky because, it almost it leaves you with the impression that every day is going to kind of be balanced. It's just not,
right.
It's just not reasonable in medicine to have that kind of acuity to the balance. For me, I really, the only thing I know to tell you is I try to go all in wherever I am, right? Like, this pocket, this is what I got going on right now. And if I'm in surgery, that's what I have going on right now.
Right.
But the trick is, and this is where I struggled early in my practice. When I was home, I wasn't home, right? I mean, I was still thinking about work, and try to compartmentalize it. It makes you better where you are, right? So better in surgery, better doing your paperwork, obviously better with your family. It makes you better. And then you have to just be real honest with yourself at the end of a month, or however you want to calculate it, the end of a week. Man, am I really living the life that I want? And if you can say that, like, yeah, I don't know how balance of time or all that, but I think you can balance intensity. And if you get to the end of the month and you say, boy, this is the right thing for me, then you can say, hey, that'll help sustain you. Burnout is a real problem, and healthcare workers are getting overworked, and everybody has their bad days. I just have no desire to paint some rosy picture for you. Like, yeah, of course I get tired. I'm not going to confess it in the moment, but now on a podcast when I'm well rested, I'll tell you the truth. Look, you just got to get the work done.
Yes.
But you also have to discipline yourself to review your own life on some frequency and say, is this really fulfilling? And if it's fulfilling, then you can sustain it. And if it's not fulfilling, make those changes.
Right. Yeah. I think making those changes can be tough, but I think today, in this day and age, I think it's more, people are focusing on that a little bit more, which is great.
Yeah.
Do you have any regrets? Anything you would do differently in your path to becoming a surgeon, or I don't know, anything?
Yeah. I mean, there were some college dates that I regret. I mean, is that what we're talking? I mean, how far back are we going? Like, you said, be honest. Yeah. I mean, regrets. I'm trying to think of how to answer that. I mean, I've been so fortunate. I mentioned I had 1 week of orthopedic surgery before I said, oh, I want to do orthopedics for the rest of my life. And you know how that match works. Like, you match into a 5-year program. And the first year, you don't really do orthopedics. Dude, I am deep into the program before I even do orthopedics. So thankfully, I don't regret that. I've had friends that matched into ortho, in fact, and then ended up backing out and said, that's not for me in their second year, and then doing emergency room. So, good for them for calling it early. But I don't think I have regrets. I mean, could I have done things better? Of course. Like, yeah, sure. But somehow the path has been, I don't think I've had any backstep. Like, the path has led me where it's led me. And,
awesome.
For that, I'm thankful. I made the just ridiculous joke that I'm probably going to pay for, about, picking the wrong dates or something. but man, that's something I did right. You know, my wife is so supportive.
That's amazing.
She's a pharmacist. She has her
Oh,
doctorate in
great.
pharmacy. And so when we got married, I was in residency, and she's in pharmacy. So I know a little bit about that if you have any questions. So anyway, but when we had our first child, she retired. And
That's nice.
and but it's worked for us, right? It's worked for us, and she's been so supportive. That's made that work-life balance that we were talking about earlier a lot easier. We're working around one professional schedule, and when maybe as a surgeon, particularly when I'm on call, those hours are a little bit less reliable. We've only had to deal with one schedule. It's obviously been a very wonderful thing for our relationship. I mean, my wife and I is that we don't have that extra stress, I guess. But it's worked for us. I don't know how, people do families with both working. So, I mean, just takes such powerful communication between your spouse and you, and, that careful time scheduling, and, it's amazing that people do that, and that's the norm. Like, that's the norm, and so I'm just so respectful of people who are able to do that.
That's great. All right, only a couple more questions. I know you have to go. We don't have to talk about this, but I know that you spoke about it publicly, kind of. You had a recent health situation. Do you want to talk about that or no?
The health? I'm just kidding.
Did you?
You're so sweet.
Oh my
No,
God.
I'm glad to talk about it. And, if there's questions, I guess none of us want to be defined by our health challenges. And who knows, like, what people are dealing with. And I think
Right.
that was the point. That's why I spoke to it, because who knows what other people are going through and how they're dealing with things unless you mention it. So yes, absolutely. Maybe a year and a half ago, I found out that I have leukemia. Now, the type of leukemia that I have is called chronic myeloid leukemia. And by the way, it's totally treatable. So
That's amazing.
my recommendation for your audience, don't have leukemia.
Okay.
That's just, if I
You
don't know
heard
if we
it
can
here
put that
first.
at the bottom or something. Like, I mean, I'd rather not have it.
Right.
But if you're going to have leukemia, this is a good one.
It's not the worst one to have.
It's not the worst. It's fully treatable. I actually connected, I didn't tell anybody for 6 months. And part of that was twofold. One is I knew that I was a little bit out there. Like, people would see me post and whatever. So I knew I was a little bit out there, and I wanted to see if I could trick everybody. Like, I wanted to see if anybody would call me out. Hey, he looks tired. Hey, he looks pale.
I did
whatever.
not notice
Nice.
anything.
Nice. Thank you for
Nothing
saying that.
different.
So I think I tricked everybody. Nobody seemed to suggest it to me. So that was cool for me. But ultimately, the treatment is a pill once a day. I have never stopped. I've never had to stop. I continue, what I think is a busy schedule. There are
That's
probably
great.
a lot of people doing a lot more than me. But when I was diagnosed, I reached out to a lot of guys. One guy was Mel Mann. He was the first guy on the pill that I'm talking about, the tyrosine kinase inhibitors. He was part of the research study. Talk about different fields of medicine that are important, researchers. And so he was on one of the first studies, or the first study at MD Anderson for Gleevec, which is the first tyrosine kinase inhibitor. So he was diagnosed with CML. This is maybe 27, 28 years ago.
Yeah.
And he was given 3 years to live.
Oh my gosh.
Yeah. The survival rate, and I'd have to look it up. We'll check it for the podcast. But he was given 3 years to live with a mortality at 3 years of like 95%.
What?
For CML.
Wow.
Yeah. This is like 27, 28 years ago. And now the 10-year survivor, now not 3-year, but the 10-year survivorship for CML is like 96%, something crazy. So it's completely flipped. And, we will all die, not to be too morbid, but I'll probably die something else. And so listen, thank you for asking.
Thank you for sharing. No, I think it's so amazing that you're able to keep your schedule and do what you do and come to these meetings and be on social media. And I think it takes a lot of strength to talk about it on social media.
Yeah, listen, there's power in kind of sharing our story. And I think that's kind of what social is. I hope that's what your podcast is meant for. Like, we just need to share our stories. We all have this. And it's tempting to think that you see somebody that's successful and you think, man, they got really lucky and everything must be going their way. And it's probably never true. Like it's never true. And why is that important? That you know that I have overcome CML? That's not the point. The point is when you get diagnosed with leukemia, or when your friend gets diagnosed with leukemia, or God forbid your child get diagnosed, there's still hope.
Yeah. Yeah, there's still hope. Last question, and it's an important one. I need to know your best piece of advice or pieces of advice for a student who might want to go into medicine or even become an orthopedic surgeon.
Yeah. Oh, that's good. I was already trying to answer the question before you finished because I'm a surgeon. Like I'm in a hurry for no apparent reason. But I think the best piece of advice in life is what some people may hear me say is something around, savor life to the bone, like drinking every moment. I think that's so critical. But I'm not sure the advice for a medical student is any different. Like just soak up exactly where you are. When people come to me and they say, "Hey, I'm thinking about doing medicine," sometimes as a test, I'll just say, "Don't do it." And just let it sit there. Because here's the reality is it's a long road. I was like 33 before I got my first real job, and somehow my parents are still proud of me, which is cool. But there's not a lot of fields that you can do that. Like most of your all's parents out there want you to have a job, a real job before 33. So anyway, somehow I was able to pull that off. But yeah, it's a long road. And the reality is there's all this, griping about what we were talking about earlier, like documentation and reimbursements are going down and the stress and the burnout rates. These are all real things. But the reality is if you love what you do, all of that fades away. So if you can find something that you truly believe in, and if that's medicine for you, my goodness, I have 2 kids. I don't know if we've talked about this, but
I don't think we have.
I have 2 little kids. And listen, let me be clear about orthopedic surgery. It is obviously the best profession in the world.
Obviously.
And everybody should do it.
Exactly.
But in truthful, it's the only one I could do. That's what I mean. I'm built for this, man.
Yeah.
Like this is what I want to do. This is where I need to spend my time. But I live in fear that my kids might go into medicine. Not because I don't think it's the best job ever, because I'm convinced it is. But it's because I would only want them to go into it if they had that same fire.
Right.
So best advice for anybody going into medicine, make sure you have the fire for what you want to do, because it's a long road. It's totally worth it. But it's a long road. So just make sure it's your passion. Short of that, what are some of the granular things? Man, get exposure as best you can. Like I wish I would have hung out with more surgeons and orthopedic guys, and I just wish I would have had more exposure. And I think the temptation there is you want just the right exposure, and these people, they're so much smarter now than I was. They're type A, they're driven. But the reality is any exposure is better. Like you think you want to be a surgeon, great. Try to hang out with a nurse. You think you want to be a nurse, great. Try to hang out with a PA. You want to be a PA, great. Try to hang out with I don't know, what would it be? Somebody else, and challenge yourself to really define. And as you well know, a little bit different for me. So I'm an orthopedic guy. Like all I do is hip and knee replacement. Like I'm not of much value, by the way. If people say, if you're on a plane and I'm on the plane with you, and somebody has a medical emergency, do not tell them that I'm a doctor. This is not helpful. I'm an orthopedic surgeon. I want to help. I'm willing to help. I'm of no value on a plane.
We will try to help.
Yeah. Well, listen. Well, my point was going to be, look, you're way more valuable than I am. PAs can, kind of float if they want, can float between many disciplines. But man, surgeons, we're really kind of a narrow focused guy. So take that into account too. If you want to be a PA, great. But what does that mean? You could be a surgical orthopedic PA, you could be in urgent care, you could be, you could do anything in medicine,
things.
Right? You could do it. And so there are those jobs too that I would take a long look at now. Hey, what are those jobs that if I'm not totally sure, what are those jobs that are flexible down the road? Look at what a nurse can do, right? They're in clinic, they're in the hospital, so many different jobs. They could do consulting stuff. They could do anything.
Yeah, lots of versatility.
So anyway, lots of versatility. I would say if you love it, None of that matters, and get as much exposure as you can. Real life exposure is what I mean. Yeah, there's a way to pad up your resume, but just focus on making sure you end up in life where you want to be.
Yeah. Awesome.
Yeah.
I love it. I did, I shadowed a few surgeons before I shadowed PAs. So I did both because I wasn't sure what I was going to do, if I was going to do med school or PA school. And I chose PA. But honestly, I think it is all about what you love and what you're passionate about. And what do they say? If you love what you do, you never work a day in your life.
Yeah, I don't think
know
that's
if it's
true.
Totally true.
Yeah, no, I was thinking the same way. It makes it easier.
It definitely makes it easier if you love what you do. But awesome.
Awesome.
Thank you.
Thanks for having me. I'm not totally sure how I could possibly have gotten picked to be with you, but I'm so thankful. Obviously, I love what you're doing. I love your availability to so many people. You share so openly, which is awesome, and we all benefit from that. So thank you.
Thank you. This was great. Awesome. Yay.
See ya.